Thanks, Brian. I didn't know I had an introduction. We don't need to do that anymore. All right, so just wanted to give everybody a quick update on our efforts at Fulton County Hospital. So for those of you that may not know, Fulton County Hospital is a critical access hospital in Salem, Arkansas. So a 38-minute drive from here. I've been burning the pavement, so got that number down. So Fulton County Hospital services offered there. They have a 24/7 ED that is it's physician staffed 24/7. They have inpatient unit and a swing bed or rehabilitation program there that is currently being run by two of our hospitalists from Mountain Home. E.J. Scott and Mike Elkins are running that program and have done a great job with that for us. There are two clinics at Fulton County Hospital. There's a family clinic. Renee Crowell is a nurse practitioner that used to work in Mountain Home. She works a few days a week in our clinic there. And then we have Dr. Anthony Anston, who is a primary care physician, I believe, from Mountain View that holds a wound clinic every Tuesday over at the clinic in Fulton County. Also have lab, radiology, so CT, ultrasound, general x-ray. We also have a couple of very nice operating rooms there, and right now all we're doing in the operating rooms is endoscopy, and that's all Dr. Cochran right now. So definitely some future opportunity there, I hope, in the operating room suites. So the update right now, like Ron said at the beginning, as of January 1st, Fulton County Hospital becomes a part of Baxter Health. So they'll fall under the Baxter Health system as a subsidiary of the hospital. So if you think of the Baxter Health umbrella, so Baxter Health system at the top, hospital here, then hometown clinics, Fulton County Hospital will fall on that same line with the new name, Baxter Health, Fulton County Hospital, as of January 1. I get asked a lot of times, why are we over there? What's the purpose of what we're doing in Fulton County? And what I tell everybody is, that's a part of the secondary market that we've been trying to control for, like Brian was talking about, the last 10 years of efforts in growing the hospital and our services. So there's about $30 million in gross revenue that comes from the Fulton County area back to Baxter Health and Mountain Home. So that's a very big chunk of gross revenue. So that's why it's so important for us to have a presence over there. Fulton County was really floundering financially, had some consultants come in, and closure was pretty imminent over there. The governor's office really had the last of the COVID money for hospitals was up for grabs. Fulton County had applied for some, Baxter Health had applied for some, and basically governor's office said that Fulton County's path to that money was through a merger. And really, in talking with a lot of people, this was the best time for us to be in a position to do that when those ARPA funds were out there kind of for the taking for the hospitals to help us hopefully be able to transition that organization on the path of sustainability. So that's the why. Right now, our main focuses out there are the transition itself. So, starting from the ground up, forming a new not-for-profit company, getting a board together, all those things going on behind the scenes, and then centralizing different functions back to Mountain Home, to the main hospital, HR, credentialing, things like that. So all those transitions are going on behind the scenes. And then, of course, putting Fulton County Hospital on a path of sustainability, that's still the big goal. There's still struggles financially out there, just like there are at Baxter and Mountain Home. So focusing on growing services, bringing new services to Fulton County to help support that community over there. So a lot of exciting things going on in Salem right now at the hospital. Some of the opportunities we have out there right now, radiology is probably the biggest opportunity I think we have. I was talking to Dr. Alderman, who's one of our interventional radiologists here in Mountain Home earlier this morning, and the Mountain Home Radiology Group is planning to start reading for Fulton County Hospital. They read in the past out there, but Fulton County transitioned to a teleradiology service 24/7, and that is the #1 complaint I get from everybody in the community. I get into the ER quick, the doc sees me quick, I get my CT quick, and then I wait 5 hours in the ER for my results. So working on getting that, hopefully within the next month is my goal, to get our guys here in Mountain Home reading during the day like they do here. Lab and pathology, we've already began sending a bunch of lab from Fulton County Hospital that they used to send out to Quest. That's coming to Baxter. Turnaround times have really improved on that. We're working on doing that for pathology as well. I know Dr. Cochran will appreciate that because all the biopsies he does when he does scopes out there. Growing the swing bed program, coordinating with the hospital here at Baxter, sending patients over there that may be too low level for our inpatient rehabilitation unit. And then after they gain some strength in the swing program, sending them back here to our acute rehab unit. So essentially really benefiting both organizations is what we're trying to do there. And then we are in the process of adding anesthesiology out there to help Dr. Cochran and his endoscopy program at Fulton County. So hopefully by the beginning of summer, we'll have a couple of CRNAs credentialed out there. And then I think that opens up a whole new, lot of new possibilities for bringing, real surgery out there, some general surgery, maybe some orthopedics, eventually some of the smaller cases. And then there's satellite clinic opportunities out there as well. I know I've been talking with Brian and Bone and Joint here in Mountain Home. I don't know if you guys know this, but your office manager's working on getting you all credentialed out there to, if you ever wanted to do a satellite clinic out in Fulton County, we've got space for you out there. So anybody, any specialty that feels like they could draw patients out there, feel free to get with me and we'll see what we can do to make it happen. But a lot of work by a lot of people. We're doing well in the community right now. I talked to Dr. Scribner, who's a well-respected physician out there, almost weekly. He's been very positive about it. His patients have. Dr. Cochran I talk to almost daily, it seems like, and so just a lot of positive momentum out there. So we're gonna, like I said, just try to get it on a path of sustainability, and we're in it for the long haul right now. We signed that agreement, it's 25 years and has provisions to auto-renew for another 50. So anything you want to add, Dr.
Sure. I think right now, the underlying thing about Fulton County Hospital and the area is potential. And since that potential is so unfilled, right now we're extremely nimble and able to do things quickly. I practice in Mammoth Spring, and I get CTs. I'm used to getting same day or next day CT scans of whatever. The only thing they can't do radiographically there, that's not interventional, of course, is breast. They can do most ultrasound, and they have a brand new CT scanner. From a provider's point of view, there's so much potential. Back in the early part of the 20th century, 21st century, not that long. The Fulton County Hospital, which basically spent the last 30, 40 years living hand-to-mouth, grant to grant, got a grant that said, we will help you remodel your ancient hospital that I was actually born in 50-something years ago. But we have a rider, you have to build this and you have to build that, and you have to, so it's got some things that you wouldn't see in a typically hospital like that. It's got two basically brand new, fully functioning operating rooms. And one of them is full of exercise equipment because the PT department has migrated into every nook and cranny. But I operate in a brand new operating room, basically brand new, an operating room every Wednesday morning. And so anybody who has need for real estate, we have enormous potential. And I'm not enough to support anesthesia, I don't think. Since I've got Baxter's Health, we've quadrupled at least trebled my volume there without expanding a day. But anesthesia is going to expand me even more. But anesthesia opens the door for gynecology or ortho or ophthalmology or anybody who's used to working in a surgery center. We have the potential to do that at Fulton County, and I'm looking forward to trying to get that to go, because I look at the balance sheet on every board meeting, and it ain't inpatient and swing bed that's gonna make all the money for us and keep us floating. We need people in there doing procedures, and we've got lots of potential. As far as that goes, last thing I'll say is that as far as nimbleness goes, as far as GI procedures go, I will see your patient yesterday and do their scope tomorrow, and so just holler at me. So that's the way we work there. I've been doing scopes for about 25 years. I've done probably 6,000 colonoscopies and slightly more EGDs, and so we've got a lot of experience. Got a great team of nurses thanks to Baxter, and so it's been a lot of fun. Thanks, excuse me, I talked too much. Appreciate it.
Just one other addition to what